many of us have encountered the individual at the bus stop having an intense conversation with somebody, but with no one? And perhaps you even came across a house during one of your walks with the windows covered up with aluminum foil. Individuals with schizophrenia live in a different reality. Like John Nash, the mathematician whose story was told in A Beautiful Mind, people with schizophrenia can flourish with help and support. Today, we will talk about schizophrenia and the policies that impact it. First, we will talk about schizophrenia, the diagnostic criteria, and its public policy trajectory, then implications of widespread acceptance, policy and public funding, and advancements in policy and public funding. Schizophrenia is a severe psychiatric disorder that is characterized by disturbances in thought, perception, emotion, and behavior. The criteria according to the DSM-5 include delusions, fixed false beliefs, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms, which is a lack of affect and also just a lack of motivation. An individual must show these symptoms for at least 6 months. There must be significant impairment in functioning in social, jobs, and daily living. And these symptoms must not be because of substance use or any other medical condition or psychiatric condition. Historically, schizophrenia has been at the center of mental health policy debates, shifting from institutionalized care to community-based care. Before the introduction of psychotropic medications like thorazine, treatment was usually involuntary commitment to a mental hospital, electroconvulsive therapy, insulin chemotherapy, and lobotomies. The development of antipsychotics led to mass closures of psychiatric hospitals. The Community Mental Health Act of 1963 was meant to provide community-based treatment to individuals released from institutions, but due to change in administration after Kennedy was assassinated, funding was diverted and dried up. The, the institutionalization and budget cuts to mental health services led to increased homelessness and incarceration of individuals with schizophrenia and other mental health disorders. The ADA helped protect not only people with disabilities, but people with schizophrenia from discrimination. And in Olmsted v. LC, the Supreme Court ruled that it was discriminatory to institutionalize people with disabilities, reinforcing the right to community-based care. Modern policies like the Affordable Care Act improved access to mental health services, and the assisted outpatient treatment laws court-mandated treatment for people with severe schizophrenia. There was also an improvement in crisis intervention in some states. For example, in Washington state, police are not the first ones to be called when there is a mental health crisis. Instead, the King County Crisis Response Team is called, and they come and assess the situation, preventing incarceration. When schizophrenia and its treatment are widespread in acceptance, there is less stigma and more opportunity for social integration. Major implications include access to treatment, better quality of life for the patient and their families, and reduced criminalization. Schizophrenia has a significant impact on individuals and the community. A policy that helps mitigate the challenges of schizophrenia is a Certified Community Behavioral Health Clinics initiative. It was established to integrate mental health and substance use disorder treatment into community settings. Clinics provide a broad range of services, including 24/7 crisis services, case management, and evidence-based treatment like CBT and motivational interviewing. Continued expansion and funding of this initiative is necessary to ensure people with schizophrenia can live a full life. Advancements in mental health policy will lead to increased access to treatment and services with a decrease in hospitalizations due to the availability of community-based services. The integration of care and holistic treatment approaches will help to reduce ER visits and homelessness. Despite advancements, treatment gaps still remain. Many individuals lack access to psychiatrists, and some regions are underfunded. Stigma still exists in housing and employment. However, we can make changes, one small step at a time. Thank you very much.